stress fractures, and I wanted to just touch upon real quick, what exercises do you suggest someone do if they have one?
You would call it spinal stabilization, core stabilization. It's a global term, so to speak. So going back to what movements someone has increased back pain in, you try to stay out of that. So someone with a stress fracture in their spine, you want to start out strengthening in more of a neutral spine. So this is, if I use this spine and I'm flexing, that's out of neutral. If I'm hyperextended, I'm out of neutral. So doing exercises in a position basically that don't provoke pain, you could almost define it as that, but biomechanically it would be from one extreme to another in terms of what the joints are able to produce, but then exercising in a particular posture that doesn't provoke pain.
All right, perfect. Now I understand, obviously, you're an expert in physical therapy, and you focus mostly on manual therapy. What is that?
Manual physical therapy is a way using joint manipulation, joint mobilization, soft tissue mobilization, hands-on work to try to treat the spine. And so part of that is not just treatment, part of that is the physical examination.
Okay.
So if I'm looking at your spine and I'm looking at bony landmarks, what is your pelvis doing? What is your different bony landmarks on your sacrum doing?
Right, because you can see some that are like that.
Yes, and so if your pelvis is rotated, if I'm looking at this pelvis and I'm looking at the heights of your iliac crest, or if I'm looking at what's called the posterior superior iliac spine and you're rotated forward. Right. Or if your sacrum, certain bony landmarks on your sacrum are turned one particular way, then you use those things as a manual assessment, and then you use manual techniques to try to detone muscles with muscle activation, mobilizing joints, and there's different grades of that depending upon the necessary treatment. But that's manual therapy in a nutshell. Would be inclusive of a diagnostic in terms of hands-on, and then treatment, manual hands-on treatment techniques.